Today we are going to start our class urinary catheterization. There are two types of urinary catheterization. First one is male catheterization and second one is female catheterization. We will discuss both, but before starting, I will tell you about some things. Just a minute. Okay. Catheterization of the urinary bladder is the insertion of a hollow tube through the urethra into the bladder for removing urine. Common condition is acute urinary retention, so we can use urinary catheter. It is an aseptic procedure for which sterile equipment is required. Purpose of urinary catheterization is relieve urinary retention and sterile urine specimen obtained from the patient. Measure reusable urine and empty the bladder before, during, or after the surgery. If anyone go for surgery, so firstly we have to empty the bladder and then go for the surgery. Allow accurate measurement of the urine output. After the surgery, we have to measure of urine output. Okay, catheter sizes. Urinary catheterization has a various sizes, and denoted the size of catheter is French, and the diameter of catheter is 0.33 millimeter. That is 18 French, and 18 French mostly used for adult. And the 8 French or 10 French are used for the children, and the number 14 French and 16 French are used for the females, adult. And the largest number of the catheter is 20 French and 22 French are usually used for the male adult. Because a large size catheter used for a male because it is stiffer and easier to push the distance of the male urethra. Types of catheter are intermittent catheter is used to drain the bladder for the short periods like 5 to 10 minutes. It may be inserted by the patient. It is a single way to use the catheter for the contain the urine specimen. Number 2 is retention and indwelling catheter. This type of catheter is placed into the bladder for secure for a period of time. It is used for the maybe a patient is chronic retention, so we can use this type of catheter. And acute urinary retention for we have to use this type of catheter is intermittent catheters. And third one is suprapubic catheter. This type of catheter is inserted into the bladder through a small incision, and a small incision above the pubic area. It is used for continuous drainage. Preparation of for the catheterization. Which equipment we have to use in this procedure? There are when absolutely necessary, and the catheterization procedure itself should be done only by trained personnel under the sterile condition. Infection is a major risk of urinary catheterization. So we have to use sterile equipments and maintain the sterilization. Okay, which equipment we have to use? Number one is catheter. If a patient is still child, so we can use 8 to 10 French catheter. If a patient is female, so we have to use 14 to 18 French catheter. If a patient is male, so we have to use 20 to 22 French of catheter size. Okay. And the 10 cc syringe, sterile water, 10 cc syringe for the balloon, for the checking for checking of balloon patency, and sterile water when we insert the catheter and inflate the balloon. So we have to insert the balloon with sterile water, not a normal saline, not a glucose water, just is sterile water. If you insert a normal saline into the balloon, there are the crystal formation. Okay. And third one is cotton balls with povidone and lubricant jelly, that is xylocaine, and sterile gloves, flashlight or a lamps, and urine collection bag, and velcro leg straps or anchoring tape, that is adhesive tape which you have. And last one is disposable bag. First of all, explain the procedure to the patient and make sure the privacy and adequate lighting, and make a position. Position of the female is a dorsal recumbent position with knee flexed and feet about 2 feet apart. Cover upper body and each leg. Place the catheter set between the female patient's leg. That is the position of a female patient, and the male patient position is a supine position, and wrap the patient. Only the area around the penis is exposed. Place the catheter set next to the leg of the male patient. Inserting the Foley's catheter in a male patient. Now here we have, I discussed you about the male patient catheterization. First of all, clean the genital and perineal areas with warm soap and water. Then dry the area, wash your hand carefully, open the sterile catheterization kit using sterile technique. Put on the sterile gloves, open the sterile drapes and place on the patient's thighs. Place the fenestrated drapes with opening on the penis. Apply sterile lubricant, that is xylocaine jelly, to the catheter tip, and lubricate at least 6 inches of the catheter. Okay, and leave the lubricate catheter on the sterile field. Pour the antiseptic solution over the cotton balls and place the urine specimen collection container within easy reach. Okay. Now the procedure. Grab the patient penis between your thumb and forefinger of your non-dominant hand. Hold the penis with your non-dominant hand and retract the foreskin, and the gloved hand that has touched the patient is now contaminated. Use the forceps to hold the cotton balls. This will maintain the sterility of one hand. You have to hold the penis from the non-dominant hand and clean the surface area with your sterile hand. Is it clear? This will maintain the sterility of one hand. Using the forceps, pick up the one cotton ball and swap center of the meatus and outward in the circular manner. Continue outward using a new cotton ball for each progressively large circle. Cotton ball in the disposable bag. After the last cotton ball is used, drop the forceps into the disposable bag. Okay, hold the penis at 90-degree angle or a parallel and advance catheter into the patient's urinary meatus. Okay, now insert the catheter tube through the meatus. You may encounter the resistance at the prostatic sphincter. Okay. Noted. Never force the catheter to advance. Over force नहीं करनी है आपने. If you placed one time, तो leave it. ठीक है. Retract नहीं करना है उसे बार बार. Discontinue the procedure if the catheter will not advance or the patient has unusual discomfort. When the catheter has passed through the prostatic sphincter into the bladder, urine is when you insert the catheter into the bladder, urine flow will start. Gently 1 to 2 inches inserted where urine is noted. Now inflated the balloon using correct amount of sterile liquid, that is 10 cc. But check actual balloon size. Normally we have to use 10 cc, but check the actual balloon size. Gently pull the catheter until the inflation balloon is snug in against the bladder neck. First, you have to insert the tube into the bladder, and urine will become, and then inflate the balloon with the sterile water, and tube will be fixed. Tube will be fixed around the bladder, and then you have to pull back the catheter. You can feel the resistance. If you feel the resistance, it means balloon is fixed, and then connect the catheter to the drainage system. Now tubing. Okay, now catheter tubing to the lateral abdomen with tap without tension or tubing. Place drainage bag below the level of the bladder. Evaluate the catheter function and amount, color, odor, and quality of urine. At the end, remove the gloves, dispose of the equipment appropriately, and wash your hand. And document size of the catheter inserted, amount of water in balloon, and patient response to the procedure, and assessment of the urine. All of these things documented on the file. ठीक है, ये क्या था? Male catheterization. Now we will start the female catheterization. Same procedure same with the male from the step A and H. And the last one is the place the thumb and forefinger for your non-dominant hand. Same things like apply the drops under the buttocks and fenestrated sheet applies, and clean the surface area with soap and water, and then place the thumb and the forefinger of your non-dominant hand between the labia minora and spread and separate upward. Expose the labia minora and labia majora, and glove and other hand which is sterile that has to touch the patient is now contaminated. Using the forceps, pick up the cotton balls which is such with antiseptic solution which is pyridine. Use one cotton ball for each stroke. Swab from the above the meatus downward towards the rectum. Clean the surface area upward to downward with antiseptic solution, that is pyridine. Keeping the labia separate, clean each side of the meatus in the same downward manner. Like a circular motion. Don't go back over any previously cleansed area. If you start from the center of the inward to outward, clean the area inward to outward. Okay. Deposit each cotton balls into the disposable bag. After the last cotton ball is used, deposit the forceps into the bag as well. Okay. If you continue to hold the labium after the cleansing. Insert the lubricant catheter into the female patients through the meatus. The catheter upward as it is as advanced. If the catheter will not advance, instruct the patient to inhale or exhale slowly. This may relax the sphincter muscles. Don't force the catheter. When urine starts to flow, insert catheter approximately 1 inch further. Place the cup under the stream of the flowing urine to obtain the sterile specimen if required. Okay. Now, inflate the balloon using correct amount of sterile liquid, that is 10 cc, which I told you. Gently pull back the catheter until inflammation balloon is snug against the bladder neck. Connect the catheter to drainage system. Okay. And then secure the catheter with adhesive tape from the female patient thigh. Place drainage bag below the level of the bladder and evaluate catheter function and amount of color, odor, and quality of urine. At the end, remove the gloves, dispose the equipment appropriately, and wash the hands. And document size of the catheter, inserted, amount of the water in balloon, patient response to the procedure, and assessment of urine. All of these things document in the file. Okay. This is completed male catheterization and female catheterization. अब मैं थोड़ा सा रिव्यू कर देती हूँ, उसके बाद कंटिन्यू करेंगे. मेल कैथेटराइजेशन में क्या था? Firstly, open the sterile packet of catheterization kit. Apply the sheet under the buttocks and fenestrated sheet. Apply the penis and open the kit of catheterization. Clean the surface area with pyridine. Hold the penis with non-dominant hand in parallel condition. It's mean upward direction. Clean the surface area with pyridine and then insert the tube into the bladder until urine flow, and then urine will come, and you have to fill the balloon with sterile water. Inflated the balloon with sterile water and pull back the balloon for checking the patency. ठीक है. इसके बाद क्या होगा? And then attach the drainage bag with the catheter tube and secure the catheter from the thighs. that is a male catheterization, and the female catheterization, same process, but expose the labia minora and labia majora and clean the surface area with antiseptic solution, that is iodine, and in a circular motion, inward to outward, or apply the xylocaine jelly on the tip of the inserting tube, and insert the tube through the urethral meatus into the bladder. When urine flow is come, then inflated the balloon with sterile water, and pull back the balloon. If it is fixed, then attach the urine bag with the catheter, and at the end of the both procedure, male ho ya female ho ya children ho, you have to document it each and everything. कितना सीसी वाटर लिया था हमने, 10 cc वाटर लिया था, पेशेंट का नाम क्या था, डेट क्या थी, एवरीथिंग क्या करना है आपको, मेंशन ऑन द फाइल. ओके. Now maintaining and indwelling catheter. Wash your hand before and after caring for the patient, and wear the gloves when handling and indwelling catheter. Clean the perineal area with soap and water twice daily, and after each bowel movement, especially around the meatus. Use a separate area of the cloth for each stroke. Avoid use of powder in perineal area. Okay. Arrange the patient to take a shower or a bathtub when permitted. The collecting container may be hang over the side of the tub. The catheter should be clamped temporarily if the collecting container is higher than the bladder. Teach the patient to maintain the catheter. Self-care helps the patient develop a feeling of independence and promotes the cleanliness. If the patient is ambulatory, instruct him in use of leg bag. Encourage the patient to intake 2500 cc to 3000 cc of fluid daily. Change the indwelling catheter as necessary or in accordance with local policy. Okay. Removing an indwelling catheter. Assemble all supplies and equipment. 10 cc syringe, you have to need 10 cc syringe, washcloths and towels, examine gloves, and soap and water. Identify the patient and explain the procedure. Advise him to that there will be a slight burning during the removal of the catheter. Okay, provide a privacy and assist the female patient into the dorsal or recumbent position. If a female patient, which position is this? Dorsal recumbent position. The male should be in a supine position. Okay. Wash your hands and put on the gloves. Examine gloves. Empty the balloon. First, empty the balloon by inserting the barrel of the syringes and withdrawing the amount of fluid used during inflation. Pinch off and gently pull on the catheter near the point where it exits from the meatus. Clean the perineum or penis with soap and water. Dry the area. And inspect the catheter to be sure no remnants remain in the bladder. If the catheter is not totally intact, report this promptly and save the catheter for further inspection. And empty the drainage bag. Measure the amount of urine and record on the intake and output I&O sheet. Okay. Remove the gloves and wash your hands, and discard the disposable supplies and return the reusable supplies and equipment to the appropriate area. Okay. Now record that the catheter was removed, the time and date, and by whom. Note the amount, color, and clarity of the urine in the drainage bag. Also document all patient teaching done and the patient's level of the understanding. All of these things you have to document on the file. After removal of the catheter, assess the patient for 24 hours of pattern for urinary elimination. Note the time and amount of the first and report any of the following conditions: inability to void within 8 to 10 hours, frequency, burning, dribbling, or a hesitation in starting the stream of urine, cloudiness or unusual color of characteristics of the urine. Provide a level of fluid similar to the intake whenever the catheter was in place. Record that the catheter was removed, the date and time, and by the worm. Okay. Anything? Now I will share you a video. Just a minute.
Good afternoon, everyone. My name is Keith Rourke. I'm a urologist here at the University of Alberta, and today I thought we would go through urinary catheterization. Essentially, today what we'll be doing is learning what a catheter is, why people need urinary catheters, go through a little bit of what the urethra is, and also run through some of the proper catheterization technique, review some types of catheters, and at the very end of it, help you troubleshoot difficult catheterization scenarios. So what is a urinary catheter, you may ask yourself? Quite simply, a urinary catheter is either a latex, polyethylene, or silicone tube that one places inside the urinary tract to drain urine from the bladder. Generally speaking, it's made up of a couple of parts. It's a tube. Most of them have two ports. One is a tube that you use to drain urine through. The second usually has a through that you inject fluid that will keep the catheter in place. So, just to demonstrate, if I inject a syringe with fluid or air into this catheter and you inflate it, you will start to notice that this balloon inflates. And as that balloon fills to usually about 10 cc's as a standard, this balloon is what holds the catheter in place while it's in someone's bladder. So that's the basic anatomy of a catheter. The other thing you'll notice is that caps do come in different colors, which indicates the different sizes of the catheters. How we measure the size of the catheter is in a unit called French. And French is simply put the circumference. So a 16 French catheter, which is what this is, purely indicates that the catheter is 16 millimeters around in circumference. And so these caps are different colors to indicate what size the catheter is. They go all the way up to 24 French, which is a light blue cap, usually all the way down in adults to 14 French, which is a green cap, or even 12 French, which is a white cap. So quite honestly, you can look at a catheter that someone has in and know exactly what size it is by simply looking at the cap. So the basic catheter anatomy is there's two ports, one for draining urine, another one for inflating a balloon, and you can always tell the size of the catheter by the color of the cap, which will tell you the circumference around, measured in French. Putting a catheter in, I think, is an essential skill in medicine. Why does someone need a catheter? Well, there's a couple of reasons, and one of the most common reasons is someone can't urinate at all, and we call that acute urinary retention. So in these instances, the patient's very uncomfortable, the bladder is full, and we place a catheter in order to empty the bladder efficiently. The other reason we put a catheter in is for people to have monitoring of their urine output. And that is usually closely associated with the degree of perfusion in their body. So measuring urine output can give you a very good idea of the status of someone's hydration and their overall volume status. The third reason that mostly we urologists put catheters in is for the purpose of evacuating clots and blood from the lower urinary tract. There are some cases where you wouldn't want to put a catheter in someone's urethra, and that would be the unique circumstance where someone sustained a pelvic fracture and has injured their urethra. In those cases, you want to do a urethrogram and assess the status of the urethra before putting a urinary catheter. In basic terms, the urethra has 4 parts, and these are divided into the anterior urethra and the posterior urethra. The anterior urethra starts at the tip of the penis, and that's called the penile urethra, obviously, then extends into the bulbar urethra, which extends behind the scrotum, and the anterior urethra ends where the membranous urethra and prostate form. So the posterior urethra is the other part, and that's both the membranous, also known as the external urinary sphincter, and the prostate. And those two together combine the posterior urethra. So when it's time to put a catheter in, always ask yourself if a catheter is needed. But once you've determined that a patient needs a catheter, you'll need some equipment. So come on over here. In terms of catheterization equipment, you'll need a set of sterile gloves. In this case, it's not completely sterile. You'll also need a sterile drape set. So most catheterization kits will come with a sterile drape, usually in 2 parts. Once you have your sterile drape, you'll also need your cleaning solution. In this case, it's a betadine solution. You'll also need lubrication, usually some form of jelly lubricant or other various forms. You will also, of course, need your catheter, and they come in various forms, and we'll review each of those near the end of the video. You'll need a syringe to inflate the balloon with water, and you'll also need, at the very end, a collection bag. And this collection bag is essentially a tube that will hook up to the drainage port of your catheter that will collect the urine. This catheter bag then usually has measurements on the side. In this case, it's not very accurate gradients, but will tell you in general terms how much urine the patient is making. And then, of course, at the very end, there's a little lever for releasing that and emptying it. So that's your basic equipment. In this instance, we have a patient here in dire need of a urinary catheter. So our first order of business after preparing the sterile field is to prep the patient and then prepare for the sterilization part of the procedure. We have a catheter drape, which in this case we'll put over the patient's genitals. And at the very same time, we'll put another one up at the very bottom to kind of create our sterile field. Once you've established your sterile field, you can do this either before or after, is we'll obtain our swabs. And what we will do is then, with one hand, which is now a little bit contaminated, take the swab with the other, and we'll dab it around the urethral opening and the rest of the penis. Now, you don't have to sterilize the whole area, but obviously the part that you will be placing the catheter through. Once you've done this, usually 2 or 3 times, you can place your swabs to the side, and then you can catheter. Make sure it's well lubricated with all the lubrication that you can get. And then you can start the process of placing the catheter. Obviously, the whole time, you're reassuring the patient that everything's going to be okay. When you grab the male penis and urethra, it's very important that the penis is pulled straight up and on stretch, because the urethra has a curve to it. And if you just leave the penis hanging and try and put the catheter in this way, it will be very difficult. So one of the key points is to put it on stretch, pull up to the ceiling as far as you can without hurting the patient. And then subsequently, with your well-lubricated catheter and a steady pressure, introduce it into the urethral meatus. And then, the key thing is not to grab halfway down the catheter. You want to very firmly, with very short sections, advance the catheter into the urethra, very gently. So about a centimeter.
अभी क्या कर रहे हैं कि hold the penis with your non-dominant hand in upward direction. That is parallel condition.
Centimeter or 2 at a time, steady pressure. Because if you grab too far back, it's going to buckle, and you won't be able to get the catheter in. So a firm but steady pressure, 1 to 2 centimeters at a time, passing the catheter in through the urethral meatus with the penis on stretch throughout. Once the catheter is in, all the way up to the hub, you can then subsequently take your syringe, insert it into this port, and you can subsequently inflate the balloon with a total of 10 cc's. So in this case, we'll inflate the balloon partly. Then what you can do is Sometimes push gently on the bladder to make sure you get urine back.
उन्होंने क्या करा, sterile water filled into the balloon, inflated, ठीक है, inflate कर लिया balloon को, and ये क्या कर रहे हैं, अब pull back कर रहे हैं, और अब ये check कर रहे हैं कि catheter जो है fix हुआ है या नहीं.
Now, some people will, in fact, prior to inflating the balloon, push on the bladder, make sure there is urine. But then once you know you're in the bladder and the balloon is inflated, you pull the catheter back, you'll feel the balloon pull, and then you'll be able to drain the bladder of urine. When it's time to take your catheter out, place your syringe, deflate the balloon, and remove the catheter. There are different types of catheters that we have available. In this case, the catheter that we inserted is commonly called a two-way catheter.
Inflated balloon, and another one is attached to the urine drainage bag.
Foley catheter. This one, just to review, has a drainage port that again you'll hook your catheter bag up to, and the other port, the second port, is to inflate the catheter balloon. Now in some instances you can encounter difficulties placing this catheter because of the angle of the urethra at the junction of the anterior and posterior urethra. So there is something called a coude tip catheter. And a coude tip catheter, simply put, is identical to a regular Foley catheter except for one key difference, and that key difference is a curve. So in this instance, in some men with really big prostates, you can't put a regular catheter in. So you'll use a coude tip catheter with the curve pointed upward and place it down the urethra with the tip pointing up. And that will help guide the catheter up and into the bladder in some difficult catheter scenarios. Another type of catheter that we have is called a three-way Foley catheter, or three-way urethral catheter. In these instances, it's very similar. You have a balloon port, and in this case, this is purple, tells you that it's 22 French. You have a drainage port where the urine will drain from, but the key difference is this third port. And this third port allows fluid to flow in to the bladder. So you have a series of ports, one for inflow and others for the outflow. So this is the kind of catheter that we put into the bladder to irrigate blood clots out and then to irrigate saline or other fluids into the bladder to prevent those clots from reforming. So these catheters, as you might expect, are a little bit bigger than the regular catheter. So in this case, this is a 14 French. In this case, it's a 16 French coude. In this case, it's a 22 French, but three-way Foley catheter. So these are very similar to any other catheter except for the third drainage port, and they're slightly bigger in size. So if you can put a regular catheter in, you can also put a coude catheter in. You can also put a three-way catheter in. Now, the coude tip catheter is very useful, as I said, for men with prostate enlargement, where you have some difficulties placing the catheter because of the size of the prostate. There are other situations where you may have difficulties placing a catheter, and one of those is somebody has a very narrow foreskin, and the problem is you can't retract the foreskin in order to get the catheter in. Another common scenario might be someone's urethral opening or the urethral meatus is quite narrow, and in those cases you may need the assistance of a urologist to dilate that area open. Another reason similarly would be a urethral stricture, which is a blockage in the urethra, or something else called a false passage. And simply put, in some of their instances, the penis may be buried or may be very swollen, and you may have difficulties placing. Other scenarios that we commonly encounter in the ward situation is what we affectionately call the self-TURP. And that is where a patient will subsequently remove a catheter forcibly, and that will cause some trauma and some bleeding. In those instances, you can safely place another urinary catheter. So as you can imagine, there is a bit of trauma sustained during that, because if you inflate the catheter balloon,
balloon patency check कर रहे हैं. Before the inserting tube, you will check the balloon patency.
It's normal size, and in this case, a three-way Foley catheter holds about 30 cc's in the balloon, as I'm demonstrating here. So that balloon, when a poor old fella steps on it and pulls it out, it can cause a little bit of urethral trauma. So in these instances, there's a lot of blood through the urethra. But in most cases, you can
थ्री वे कैथेटर में बलून पेटेंसी कितनी होगी, बलून इन्फ्लेशन कितना करना होगा, हमें 30 सीसी करना होगा। और नॉर्मल जो फॉलीज कैथेटर है जो 18, 14, 16, 20, 24 जो है उसमें हमें कितना करना होता है। जो टू वे कैथेटर होता है उसमें हमें 10 सीसी सिरिंज डिस्टाइल वाटर फिल करना होता है। इसमें हमें कितना करना होगा, 30 सीसी करना होगा।
try to put another catheter in. It'll drain the urine and tamponade any of the bleeding. Another issue that we'll encounter is people will have difficulties placing a catheter after a fairly long distance. So the catheter will go in about halfway down the urethra. In those instances, you should probably suspect a urethral stricture. And then what you could try is smaller catheters. If you're using a 16, maybe try a 14, or even go down to a 12 or 10 French. You might be able to negotiate through that area of narrowing. So if somebody you suspect has prostate enlargement, you can try a coude tip catheter to negotiate through the prostate with the tip pointed up. And in some cases, it may be very helpful to use a larger catheter because a big prostate may require a little bit more pressure to negotiate the catheter through those large lobes. If your catheter doesn't go very far in before you hit a blockage, you may want to use a very small catheter like a 14 French. In other cases, if there's a bit of bleeding from the catheter being removed forcibly, placing another catheter is usually no big deal. So in summary, a urinary catheter is an important part of a doctor's job, at least I think, and I think it's an important skill for every healthcare professional. We use catheters for things like urinary retention, which help patients tremendously. We also use catheters to monitor the volume status of sick patients. Keep in mind that catheters, for the most part, are very easy to place. Keep in mind the urethral anatomy. Also, now you're aware of the three different types of catheters: the regular two-way Foley catheter, the coude tip catheter, and the three-way catheter. And keep in mind some of the common difficult catheter scenarios that we reviewed. And whenever there's a doubt, do not hesitate to call a urologist. It's our job.
And today I'm going to talk to you about how to place a urinary bladder catheter. This video will cover the indications, contraindications, supplies you'll need to place the catheter, how to prepare the patient, how to place the catheter while maintaining sterile technique, securing the catheter, as well as some troubleshooting and complications that can arise. You should already be aware of the relevant anatomy and have a basic understanding of the indications and contraindications. Speaking of which, indications for indwelling catheters include the need to precisely monitor urinary output, relief of urinary retention, a neurogenic bladder, patients who are immobilized or incontinent, including patients that are not conscious, and intraoperative patients, and after urethral surgery. Non-indwelling or straight catheters can be used for retrograde bladder irrigation, obtaining sterile urine samples, such as in children who are too young to produce a clean catch sample, or to administer contrast for certain radiologic studies. Of course, there are other indications, but these are many of the most common reasons. Contraindications for placement of a urinary catheter include a history of urethral stricture, a urethral trauma, which you should suspect in patients with a high-riding prostate on rectal exam, blood at the urethral meatus, or perineal or scrotal hematoma or ecchymosis. Relative contraindications include patients with acute urinary tract infections and anticoagulated patients. Catheter-associated urinary tract infections, or CAUTIs, are a huge source of nosocomial infection, so always think carefully if your patient truly needs an indwelling bladder catheter. I've talked about both indwelling and non-indwelling catheters, so it's probably a good time to talk about that a little more. Indwelling catheters, such as this one, are placed under sterile conditions and have a balloon at the end to ensure that they stay inside the bladder. They're used when the patient will need catheterization for several days. The most common type of indwelling catheter is a Foley catheter like this one. It comes in various sizes, measured using the French system. On the internal end, it has a balloon to ensure that it stays in place. On the external end, it has two branches. One drains the urine into the collection system. It's connected to some tubing and then to usually a bag. while the other is used to fill the balloon with sterile water. We would put it in here like this and blow up the balloon. Be sure to check the number on the ring at the end of the catheter, because that will tell you how much volume to use when filling the balloon. Other forms of indwelling catheters also exist. The Coude catheter is a catheter with a bulbous tip and a curved end, and it's used for patients who have urethral obstructions, such as from benign prostatic hypertrophy. It's placed using a bit of pressure, but the principle of placing it is the same. It has a balloon and it's indwelling. The other type of catheter is a non-indwelling or straight catheter. These are used when the patient only has to be catheterized once. They are still placed under sterile technique, but they don't stay in the body after the bladder is drained. They are not connected to a collection system, but instead drain directly into a basin. Many people self-catheterize at home using a straight catheter. When you determine that your patient needs a bladder catheter, talk to the patient explaining why they need it, what will happen during the placement, and talk about risks, alternatives, and answer any questions that they may have. Inquire about allergies to latex or iodine, as many kits come with parts that contain these chemicals. Ask the patient if they have ever had a previous catheter inserted, and if there was any difficulty with the insertion. Let's briefly talk about the supplies you'll need for placement. Most institutions use commercially available catheter insertion kits that contain all the necessary items you'll need for catheter insertion. In that case, all you'll need to do is look on the outside of the box and choose the appropriate size catheter for your patient. 16 or 18 French is typical in an adult. Let's look at a kit that contains everything you'll need. Sometimes the catheter is packaged separately, as with this kit, so make sure you're choosing the right kit. In addition to the catheter, you'll need cleaning towelettes or soapy water, non-sterile gloves, absorbable pads, sterile gloves, a fenestrated drape, betadine or iodine with applicators for preparing the patient, lubricant, a sterile syringe with water or saline, and a collection system. In this video, we'll be focusing on placement of a Foley catheter in a patient with a vulva. Positioning is key for this procedure. Place the patient in a supine position with their knees flexed and soles together in a frog leg position. Place a waterproof or absorbent pad under their buttocks and upper legs. Ensure privacy for the patient. Sanitize your hands and put on non-sterile gloves. Cleanse the vulva and perineum with towelettes or with soap and water. Now that the perineum is washed, it's time to move to the sterile portion of the procedure. Make sure to place the sterile field in an easy-to-reach location that ergonomically works for you. You will be doing most of the work with your dominant hand, so that should be the side closer to the field. Place the sterile sheet under the patient, touching as little of the sterile part as possible. Don your sterile gloves like so, making sure you have nothing below your elbows such as a watch or ring. Open the fenestrated drape and place it over the patient. Pour the iodine over the applicators and squirt the lubricant onto the sterile surface in front of the patient. 2% lidocaine jelly can also be injected directly into the lumen of the urethra with the syringe. Remove any packaging and connect the collection tubing to the catheter. Place the tip of the catheter in the lubricant. Attach the sterile water to the port on the catheter. Though it used to be commonplace to check the balloon, the manufacturer and most institutions no longer recommend this step. You will use your dominant hand to hold and place the catheter. If you're using your left hand to place the catheter, stand on the patient's left side. Spread the labia majora and minora apart with your non-dominant hand, exposing their urethral opening. Your non-dominant hand is now contaminated and cannot assist in placement until the catheter is in place and the balloon is inflated. Cleanse the periurethral mucosa from the top down toward the vagina using one downward sweep of the prep solution, then discard. Use the next two prep sticks
swab for one sweep. ठीक है, ये मेथड आप लोग याद रखिएगा.
To cleanse the left, followed by the right side of the periurethral area. Continue to spread the labia with your unsterile non-dominant hand. Grasp the pre-lubricated catheter and insert the tip into the meatus.
आप क्या करेंगे? During the insertion tube, ask the patient take a deep breath. ठीक है, फिर हम क्या करेंगे? Insert करेंगे.
When placing bladder catheters in patients with a vulva, advance the lubricated catheter until urine is seen in the tubing, and then advance another 2 to 5 centimeters before instilling saline into the balloon. Once at the correct depth, instill the correct volume of saline into the balloon and gently pull back on the catheter until resistance is met. Re-advance the catheter 2 to 3 centimeters so the balloon is not putting pressure on the bladder neck. Remove the drape from the patient. Now it's time to secure the catheter. Many kits come with a stabilization device. Usually this device has a mechanism to lock the catheter in a single orientation and adhesive on the other side to secure it to the patient. So, like this. If there's no stabilization device provided, use 2 pieces of tape to secure the tubing to the patient. The first piece of tape goes directly on the patient's leg, under the tubing. The second piece of tape goes over the first, around, and is taped to itself before it's taped down. This provides a mesentery that provides a lot of stability for the tube. Whether using tape or a commercial stabilization device, leave enough slack in the catheter and tubing so there's no tension on the bladder neck. The tubing can then be clipped to the sheets or the patient's gown. The bag should be placed in a dependent position and maybe above the bag. Let's talk about errors and complications. By far the most common error is a break and sterile technique. Once your non-dominant hand touches the skin, it's contaminated and cannot touch any of the tubing or the catheter. Likewise, your dominant hand must stay sterile and not touch the penis or vulva or outside the sterile field. Another common complication is urethral trauma secondary to insufficient lubrication, leading to pain on insertion. If urine leaks around the catheter, gently tug it to see if the balloon is inflated. If it is, you may need to replace the catheter with a larger French size. If no urine drains, ensure the catheter is fully inserted, deflate and reinflate the balloon when you are sure you're in the bladder, and gently press on the bladder. If you place the catheter and get return of frank blood, it is likely either misplacement of the catheter, traumatic placement, or attempted removal before the balloon is deflated. It can also be from infection, post-urinary tract surgery, stones, trauma to the urethra or pelvis, or cancer in the GU tract. In this case, ensure correct placement, order a CBC and urinalysis, and make sure that an IV is in place, and consider making sure that blood is available. In the setting of trauma to the pelvis, bladder, or urethra, consider a retrograde cystourethrogram. If you're pre-rounding on your patients and find a previously functioning catheter is no longer working, check the catheter placement by pulling back gently until resistance is met. Make sure none of the catheter tubing is kinked, clamped, or dislodged. Seriously, this is the most common cause of loss of function and the easiest to fix. If it's not a problem with the tubing, consider blood clots, urinary sediment, and stones. If the catheter is no longer draining, palpate the abdomen to check for bladder distension. Check with your resident or attending to see if they want you to irrigate the catheter using sterile technique. If all else fails, it may be necessary to replace the catheter. However, check with your resident or attending before doing so. So there you have it, the indications, contraindications, and some troubleshooting of urinary catheters. We talked about the supplies you'll need and how to maintain sterile technique while placing the catheter. Some advice: ask someone if you can open a kit before you have to place one. That way you can familiarize yourself with the kits at your institution and be ready to place a Foley without confusion when the time comes. Ask nurses to let you place a Foley catheter whenever you can. There's only one way to get good at doing it, and that is with practice. Most nurses will be happy to help and will stay with you to make sure you don't run into trouble. Hopefully this video was helpful. Be sure to watch the video on bladder catheterization in patients with a penis as well. Have a good day.
Please turn on the chat. If anyone has a question, you can ask me. Any question regarding the urinary catheterization? Our next class will be held on Monday at the same time. अगर किसी ने क्लास मिस कर लिए तो वो नेक्स्ट क्लास ले सकते हैं. Any question? Any question? Okay. अहमद अली, ओके, थैंक यू सो मच. आप मुझे ईमेल आईडी सेंड कर दें अपनी, मैं आपको फिर इसकी प्रेजेंटेशन और ये वीडियो लिंक शेयर कर दूँ. थैंक यू सो मच.